Hey there. If you've been thinking about adding exotic pets to your practice, you're in the right place. Last time we talked about why treating exotics can be great for your clinic. That video is linked in the description if you missed it. And today we're talking about how to do it successfully. I'm Dr. Kristen Turner, and I'm board certified in exotic companion mammal practice. I'm the founder of the Exotic Vet Consultant, and I empower general practice veterinarians to provide exceptional care to their exotic patients. I'm going to break down how to add exotics to your practice into simple, actionable steps. So let's dive in. One of the biggest mistakes I see vets make when adding exotics is assuming that they have to treat all exotic species, and that's just not true. Start small. Maybe you feel comfortable with rabbits and guinea pigs, but aren't quite ready for reptiles or birds. That's totally fine. And keep in mind, you can always start with one or two species and then expand your offerings over time. Once you decide what species you're comfortable with, make sure you have the right equipment, medications, and knowledge to treat them safely, which we'll get into. Being willing to treat exotic pets is great, but you need a solid foundation in husbandry, triage, and common conditions first. The good news is that there are so many resources to help you get there, and I'm going to list some of them here, and they'll be linked in the description below. My first resource I highly recommend is joining some of the exotic veterinary associations like the AEMV, AAV, and the ARAV. They act as a great resource for both client and veterinary information and provide a lot of support in the form of members-only Facebook groups that you can ask questions on. There are free and paid online resources such as Ven. Lefebvre is an exotic pet food company that also provides a lot of education. And Oxbow, who is also a pet food company, they have a site called Vet Connect. They have quite a bit of educational materials on exotic companion mammals specifically. And there are so many conferences and continuing education courses. Some are very specific to exotic pet medicine, like Exotics 365 and Eye Care. And most of the large conferences offer exotics tracks as well. So like VMX and WVC both had dedicated exotic tracks this year. Virtual continuing education, like the course I teach, Exotic Vet Med Essentials, is also available and can be done on your own schedule from the comfort of your couch, which is always great. These are all fantastic resources that are going to help you build confidence and connect with other vets who treat exotics. Keep in mind, your team is also on the front lines. They need to be just as prepared as you are. So you want to train your support staff in species identification, basic husbandry, red flags for potential emergencies, and safe handling and restraint of each species that you decide you're going to see. Many of the resources we talked about for veterinarians also offer training for technicians and support staff. So when everyone is on the same page, your practice is going to run so much more smoothly. This next one is super important. Depending on where you practice, certain exotic pets might be illegal, or there may be restrictions on ownership. For example, ferrets are illegal in California. Now that doesn't mean people don't have them. So there are some questions you'll want to ask yourself, like, are there any species banned in your particular state? And if so, how will you handle it if an owner calls and asks you to see it? Are you going to treat exotic pets that don't have the proper permits? Are you going to see wildlife cases? And do you feel comfortable treating things like primates or venomous reptiles? Those are things that you want to decide ahead of time so that you're prepared. Having clear policies in writing before these cases come up is going to make your life much easier. Now, exotic pets have very different needs than dogs and cats in the veterinary setting, so you will need to invest in a few key pieces of equipment. Now, this is, again, just the basics, but some starter things that you want to have before you start introducing these guys into your practice is going to be escape-proof enclosures. So that can be for our small mammals, sometimes kennels that we use for dogs and cats. Although with smaller species like small rodents and sugar gliders, you have to make sure that the bars are close enough together to prevent them from getting out. And then for our reptiles and sometimes birds, terrariums can work well, or incubators. We also want to have plenty of options for heat sources, so things like bear huggers, heat lamps, and incubators. We want the proper tools for restraint, so that can be lots of different towels. For birds, perches can be very helpful, and soft padding so that we can appropriately handle these guys. We want a gram scale to be able to appropriately weigh them. Some of these guys are so small, weighing them even on a baby scale is going to be very inaccurate. I also really recommend either a pediatric or an infant stethoscope, as well as a Doppler ultrasound to help you get your vitals on these patients and monitor. And then, of course, small gauge needles, syringes, microtainers for blood collection. And again, we're kind of just scratching the surface. And as you increase your caseload, you're going to want to consider more specialized equipment for things like rabbit dentistry. But at the beginning, start with the basics, and then you can expand as needed. Now, seeing exotic pets often takes more time than dogs and cats, especially for first-time visits. I recommend allocating at least 1 hour for initial exams at the beginning, and sometimes even later on. I definitely have spent more than an hour with even wellness exams for owners that are very in tuned to getting husbandry correct. You also want to price your exotics visits at or above your dog and cat exam fees. Remember, this is a specialty. Even if you're not a specialist, it's a specialized service. You want to reflect your expertise and time in your pricing. Your knowledge is valuable, so don't underprice these visits just because you're new to exotics. While it's important to be clear with clients if you're not a specialist, that doesn't mean you shouldn't charge for your services appropriately. So we've made it through those steps and you're all set to start seeing exotics. Well, we got to get the word out somehow. So the best thing to do is start with your current clients. So many of them probably already have exotic pets that they're either taking elsewhere or they're not getting exotic pet care at all. When you join our different exotics organizations, they're going to have online directories to where clients can go and search for a vet. So that's another benefit of being a member of those different organizations. It can also be really helpful to partner with exotic rescues and pet stores. They'll allow you to get a higher volume of patients and get more experience with a little less pressure than individually owned animals. Attending reptile expos and pet events can also be very helpful, and you can also bring things that will help draw them into your practice and showcase your expertise. And then also let surrounding small animal, urgent care, and ER vet clinics know that you're seeing exotics so that they can refer cases to you. Nobody wants to turn away clients, but if it's a practice that doesn't see any exotics, they really appreciate knowing where to send their clients. So there you have it. That's your step-by-step guide to successfully adding exotics to your practice. It's not as overwhelming as it seems, and trust me, it's worth it. If you want to get started fast, check out my course, Exotic Vet Med Essentials. It's designed to get you confident seeing exotics in just 6 weeks. If you've got questions, drop them in the comments, and don't forget to like and subscribe for more exotic vet med tips. See you soon.